The cardiac cycle is equivalent to one complete heartbeat, during which both atria and ventricles contract and then relax. We will begin the discussion of the cardiac cycle with the heart in complete relaxation, or diastole. At this point, the pressure in the heart is very low. Blood is flowing passively from the pulmonary and systemic circulation into the atria and on through to the ventricles. The semilunar valves are closed, and the atrioventricular valves are open. This is shown in the first diagram as ventricular filling. Shortly, atrial contraction occurs and atrial pressure increases, forcing residual blood into the ventricles. This is depicted in the second diagram as atrial contraction. Ventricular filling and atrial contraction are depicted in an electrocardiogram in the PR interval. Then ventricular systole begins, and intraventricular pressure increases rapidly, closing the atrioventricular valves. This is shown in the diagram on the left as isovolumetric contraction. When ventricular pressure exceeds that of the large arteries leaving the heart, the semilunar valves are forced to open, and the blood in the ventricular chambers is expelled through the valves. During this phase, the aortic pressure reaches approximately 120 mm mercury in a healthy adult. During this phase, the atria relax and their chambers fill with blood, which results in gradually increasing atrial pressure. The diagram on the right depicts this as ventricular ejection. Ventricular systole begins in the QRS complex of an electrocardiogram and ends in the T wave. At the end of ventricular systole, the ventricles relax, the semilunar valves close, and momentarily ventricles are closed chambers as shown on the diagram on the left, which is in isovolumetric relaxation in early diastole. Early diastole occurs in an electrocardiogram during an intraventricular pressure is again less than atrial pressure. The atrioventricular valves are forced open, and the ventricles begin to fill with blood again. Atrial and aortic pressure decrease, and the ventricles rapidly refill, repeating the cycle as shown in the last diagram. The average heart beats approximately 75 beats per minute, and so the length of the cardiac cycle is about 0.8 seconds. Of this time period, atrial contraction occupies the first 0.1 second, which is followed by atrial relaxation and ventricular contraction for the next 0.3 seconds. The remaining 0.4 second is a period of total heart relaxation. This concludes the cardiac cycle.